Hello, everyone, and a warm welcome. Welcome to our audience here at Radcliffe and to those joining us online. I'm thrilled to welcome you to our first in the public talk series, or our Fellows Public Talk series. I'm Claudia Rizzini, Executive Director of the Radcliffe Fellowship Program at Harvard University. Before I introduce our speaker today, I'm going to say a couple of words about the Q&A session that will take place at the end of the talk. To submit your questions, you can use the Slido link, which is posted here on the side of the room, and in the chat feature of the Zoom webinar for our online audience. We encourage you to submit your questions at any time throughout the program, and we will address as many as we can at the end of the talk. Thank you. It is my pleasure to introduce Diana Hernández, a Radcliffe Salata Climate Justice Fellow, whose talk is included as part of Harvard Climate Action Week 2025. Climate Action Week is organized by the Salata Institute for Climate and Sustainability at Harvard University, and Radcliffe is pleased to participate in this way. Diana Hernández is Associate Professor of Socio-Medical Sciences at the Mailman School of Public Health at Columbia University. Her work focuses on social, environmental determinants of health, particularly at the intersection of energy, equity, and housing. The cool breeze of air of an air conditioner, a charging phone on a nightstand, the soft hum of a refrigerator. Every flick of a switch and push of a button testifies to the invisible force powering our lives, household energy. Diana is a pioneering sociologist in energy insecurity research. In her work, she asks what happens when people can't reliably access or afford the energy needed for day-to-day life. She often hears the answer in conversation with everyday people in their living rooms. As both a scholar and practitioner, Diana's research reveals the cascading social, economic, and health impacts of energy insecurity. From deciding between paying utilities and buying groceries to living in housing that worsen physical and mental health, Diana's research reframes energy as a determinant of health and equity, rather than merely as a technical service. In her debut book, Powerless, The People's Struggle for Energy, she outlines policy interventions, including expanding the energy safety net and embedding equity in the energy transition that supports both public health and sustainability. As Diana's work demonstrates, energy insecurity is profoundly personal and requires human-centered perspectives. While at Radcliffe, Diana will be focusing on translating scholarship on energy insecurity into localized approaches and community-driven solutions. The Q&A portion of the public talk today will be moderated by Rachel Morello-Frosch, 2025-2026 Radcliffe Salata Climate Justice Fellow and professor in the Department of Environmental Science, Policy and Management, and the School of Public Health at the University of California, Berkeley. And now please join me in welcoming Diana Hernández.
Thank you so much, Claudia, for that very generous introduction. It's so lovely to see all of you and to have a full room. I want to acknowledge a few people. I do believe that recognition and gratitude is a good way to start any talk. And so I want to acknowledge all of the effort to basically organize this event on behalf of the Radcliffe events team, as well as the Salata Institute, and to include it as part of Harvard's Action Climate Week. And I also want to acknowledge and say that I'm so excited to be in conversation with Rachel. Jack Spangler, who is coming in from the Harvard School of Public Health, is also here. He's been a longtime mentor and supporter. I'm really grateful to have you here. And of course, I want to acknowledge my co-author, Jennifer Laird, and my teams at Columbia that really help to move this work along. And so I'm really honored to represent them in this effort. It's getting hot in here. That's really, in some ways, the takeaway around climate change. The idea that we are year on year basically having hotter and hotter temperatures reaching new peaks. This is according to the National Oceanic and Atmospheric Administration, basically noting that 2024 is indeed the hottest year on record. This is very similar information on the left-hand side, which really kind of shows, again, the heating of the rising temperatures. And when we look at this, we also look at it from kind of a spatial perspective. So our planet is warming, but there are some places that are warming faster at an accelerated pace than others, and that happens to be the Arctic area of the Earth. And as you can see kind of on the bottom left, it's a hot zone. So last year, I was invited to be in the Arctic. Now, it was amazing and actually really impactful to see the beauty and wonder of ice. I never really imagined that I would be able to describe ice as magical, but it really is. And that when you see ancient glaciers that are basically falling before your eyes, that it could actually feel painful. And that the sight of a polar bear would basically excite people, and that there was this amazing image, these are all real images from that trip, of this amazing happy seal. And oftentimes when we think about climate, these are the kinds of images that come to mind. But of course, I'm a Bronx girl, and so when I was in the Arctic, I was thinking about my 3-year-old, or my almost 3-year-old at that point, earlier in the year, who had actually never played in snow. And the first time she did, she played in really meager snow, right? This is like weak snow, like barely there. And she did it Bronx style on a plastic garbage can lid, because that's, like we're raising her the right way. And so some of the ways in which we could be thinking about climate is about these kinds of losses, the loss of fun and recreation. But the truth is that my context has shown me that many people are actually dealing with real concerns that are much more proximal and less about fun and recreation. And an example of that really kind of reappears on a regular basis. And this is an example of a tragic fire that happened in January of 2022 in the Bronx, where basically there were 17 people killed in a fire, 8 of them children. And the cause of the death trap was basically reported as a malfunctioning self-closing door where the stairwells had become basically chimney stacks. But as I kind of started to look a little bit deeper, the real cause of the fire was actually a faulty space heater that was on for days on end. And I have found it necessary to dispatch from my position as someone who loves the Bronx and who is situated very closely there, and to contextualize these kind of current events. And so I wrote this op-ed in the New York Daily News that basically said, the misery and fatal impact of inadequate heat and poor housing conditions that Bronxites face must be recognized for what it is: a predictable harm and a preventable wrong. Beyond greater fire safety messages, the takeaway from this latest calamity is that Bronx residents deserve to experience energy security, thermal comfort, and dignity at home. And I wish that this was kind of an isolated incident, but just earlier this year, we had another building up in flames. The root cause, very similar. And I want to acknowledge that these are just some of the everyday manifestations of hardship. But 2025 actually marks a key moment, also a milestone for other climate events, extreme weather events. The Chicago heat wave of 1995, which claimed 739 lives, and of course, Hurricane Katrina in 2005. The images there are very much about low income, Black people of color that were disparately impacted by climate events. And that, when I think about the intersection of climate and justice and health, I think about the next Katrina, the next heat wave that has the potential to also prey upon the most vulnerable. So when I think about what it means to bridge the polar bears on the one hand and the images of concern oftentimes that are more environmental in nature and what people care about at the kitchen table, I think it's really important that we start to have more inclusive ways of thinking about the climate and thinking about climate justice and activating it. Because at the kitchen table, people care about having a roof over their head, having food on the table, and being able to keep the lights on. And energy is actually an important kind of connective tissue around both climate and everyday concerns. The International Energy Agency basically describes energy and climate as being inextricably linked. And basically, energy, the production and the consumption of energy actually accounts for 75% of greenhouse gas emissions, making it the primary driver of climate change, according to the IEA. Well, what do we think about in the everyday sense how we are actually interacting with energy? It's for heating, it's for cooling, it's for cooking, it's for lighting, it's for refrigeration. We're not necessarily talking about luxuries, we're just talking about the infrastructure that helps us live our lives day to day. But there are many people, millions in fact, and I'll go over that over the course of this talk, that can't afford or they can't meet their energy needs, and therefore they are experiencing energy insecurity. I want to acknowledge the fact that it was right here in the Boston area, across the bridge, that I came to understand energy insecurity. I had been doing my dissertation research in the mid-2000s and sitting in people's living rooms and asking them questions about the links between housing and health. I was working on a study about the medical legal partnership. So, we were prepared to ask about lead and asbestos and crowding and mold. But what people were actually talking about were their homes being too cold, or they were being shut off, or they were at risk of that, or that the transition from oil to gas had actually presented a lot of challenges at that point. And I believed them. And not only did I believe them, I thought it was very important to actually add to the academic and scholarly corpus of work a way of describing energy, these energy issues that people were describing for themselves. And they weren't necessarily just talking about it as utility bills, although of course the economic dimension of energy insecurity is very critical. It was actually in meeting residents in Boston public housing that I realized that there was a physical dimension to this. So even as people were not necessarily confronting a utility bill, they were still using their stove or oven for heat, or they were still experiencing electricity problems and plumbing problems in their homes. So ways of thinking about utilities and from a physical standpoint, and what I love about thinking about the physical aspect is that there are actually sometimes clearer solutions to that. but also that there is agency, that people are actually coping, that there is a behavioral and an adaptive aspect to the ways in which people are contending with these physical and economic challenges in meeting their energy needs. So, like any other medical, sometimes you go in for an MRI and, you're looking for one thing and you have this kind of incidental finding that needs a follow-up. I really do think of that initial study in Dorchester as being that. It was an incidental finding in the context of a very different study that needed a follow-up. It needed a follow-up at the national level. It needed a follow-up in places that were not cold. It needed a follow-up in ways that helped us to really situate and focus in on the problem of energy insecurity. And so the book that was published earlier this year, just a few months ago, Powerless, The People's Struggle for Energy, tells that story. And it tells that story via numbers and narratives. It was a mixed methods approach. I personally conducted over 100 interviews around the country and administered an original survey, and then also used existing government data, and then came up with an action framework. Because again, for me, it wasn't enough to just measure and make sense of these kind of lived experiences, but also to find pathways to offer relief. So I'd already kind of uncovered energy insecurity and described it as multidimensional. But what are kind of adequate indicators of energy insecurity? How do we really kind of hone in on the actual experiences of the physical elements of energy insecurity, the economic elements, the coping elements? And the residential energy consumption survey allows for that. It allows for kind of dissecting and measuring at the population level with a nationally representative sample these indicators. And basically, in this kind of most conservative of estimates, we basically say and find that if we use the economic indicator, in this case, disconnection notices, as a baseline, and then that any household that experiences an additional indicator of energy insecurity is impacted, we find that 10%, so 1 in 10 households in the US are impacted by energy insecurity, but another 40% are at risk, meaning that they're experiencing some other indicator, not an economic one, but we know that, especially in kind of moments of economic volatility, that anybody could actually be, could experience an economic hardship. And so these are part of the populations that are at risk, and therefore, you have 1 in 2 households that are experiencing some form of energy insecurity. This is millions of households experiencing these various indicators of energy insecurity. But in some ways, just doing that isn't necessarily motivating. But before I get to the motivations, I do want to talk about the kind of patterned inequality. So this is households that experience any energy insecurity by socio-demographic group, as well as by housing indicators. And what we find is that across the board, communities of color, low-income groups, people with less than college education, households with children, people living in mobile homes, renters, people living in older homes, and people living in rural communities are all more likely to experience energy insecurity. And if you're wondering about protective factors, elderly households and people and households that are living in buildings that are larger than 5 units, there are protective factors around energy insecurity for those groups. But I'm a sociologist who really loves people, talking to people, connecting with people. And I basically traversed these 10 different places: California, Montana, Arizona, Texas, Alabama, Tennessee, New York, Pennsylvania, and Detroit, Michigan, as well as Puerto Rico, to basically understand the lived experiences. And I connected to the energy assistance kind of orbit around community action agencies, as well as advocacy networks and other organizations like legal services, a food pantry, as well as disaster relief in Puerto Rico. I just want to start with an example of a story. This is the story of Alicia. And for me, Alicia, and in the book, Alicia really is this kind of emblematic figure, right? She is a woman, she's a mom, has 5 children, is basically struggling with a work-limiting disability. In her home, when she turned on the tap, it was brown water that ran through the pipes. Their home had no heat. It also lacked air conditioning because the air conditioning unit was stolen. She went to the Community Action Agency in Shelby County in Memphis with a $480 arrearage and a disconnection notice, meaning that she owed the utility company almost $500 and was basically at risk of a shutoff as a result. And she had already lived through that. In fact, as part of the quote here, she basically says, like, it's a shame that my children have had to live without utilities through a shutoff. But what that meant is that very often she had difficult choices. And those difficult choices were about her needing to decide between replacing her child's shoes that had really reached their end and then having to pay the light bill. And for millions of households in the US, it is actually that tension that is happening month after month. And the challenges are not necessarily just economic, they're also physical, as I explained, around her housing situation, and all of the different ways that she would cope. Not only did she put in energy efficient curtains, but she also went to a friend's house. And you know what she appreciated most about that friend's house? That they had central air conditioning, and that they would be able to go from one room to another room without concern about one room being too hot or too cold. Because otherwise, in the wintertime, what the family did was camp out in the living room with the oven door open and the heat on as high as possible, because otherwise they could not achieve warmth. That's just one example of the many that I experienced while in the field, and what over 100 of those interviews basically taught me was that there are actually shared traits, these essential elements of energy insecurity. On the economic side, difficulty paying, utility debt, disconnections. On the physical side, inefficiencies and deficiencies, as well as power outages. On the coping side, these difficult choices and trade-offs, the discomfort and the dangerous alternatives, deprivation, so the underconsumption of energy. And much as we have a language for explaining food insecurity, the felt experience of food insecurity as hunger and malnutrition in its most extreme form, we also now have a way of describing the felt experience of energy insecurity as drain, and in its most extreme form, depletion. Because that's actually, it's basically your energy, your personal energy, your psychic energy, your physical energy, and your financial energies are depleted. I have 10 minutes. I don't know how I'm going to do that. I just want to talk about, I'll just go through the stories because these are the ones that are most compelling to me. But this is a woman that I met in Alabama. Her name is Betty. And when I met her, she had this letter and she had a frustration. And her frustration was really about, listen, I turn everything off. There's not an appliance, there's not a clock in the house that is not on unless it needs to be on. And yet I still can't keep up. She felt really secure in her abilities to actually consume as little and conserve as much as possible. But she actually wanted me to assist in filling out the details of this letter. And I did that with pride. And when I think about what powerless is, it's basically the long form of that letter. And the truth is that her inclination and her understanding of what was going on was actually is appropriate and actually tracks with the realities of high bills, and that in areas that are kind of experiencing, like in the Southeast, high heat and high temperatures, their bills tend to be higher. So she's living in Alabama, where they have some of the highest actual bills in the United States, right? So this was on track, but let's just put this kind of in perspective. There is an increase in utility pricing. So if you look at the residential bar, that's this orange bar, but also then look at the revenue stream, so the high profits that are coming from energy, then we also have to really ask ourselves, where is this exploitation based? And when energy intersects with poverty, indeed, people are suffering. This is a woman that I met in Detroit. And she basically was watching the nightly news one day. And there was another woman, actually, that was depicted on the nightly news where she said, you know, I'm living in a home that's unheated. My pipes have frozen. And meanwhile, Edith is looking at this and saying, you know what? Actually, that is my experience too. And I thought I was the only one, but I'm not. And in bold, and I won't go through it for the sake of time, but you'll see the routine that she had to go through as a result of not having a heated home and basically living without running water in her home. This is an actual picture from Zillow of her house. And this is a caption from the Zillow ad that said, there's huge profit potential. The home is in need of a total rehab. It's absolutely gorgeous with all the size and characteristics you want in a rehab. And eventually she was displaced from this home, despite the fact that it was their family home. And there was legacy in that home and pride in that home, but ultimately she was displaced. And when I think about Edith's story in the context of the health of our housing, of our nation's housing, what we're really seeing is that 37% of our housing stock is actually presenting with different forms of physical energy insecurity, the lack of insulation, drafts, not having air conditioning units, broken air conditioning units, or heating just the same. And that often leads people to these kind of dangerous alternatives, or what often feels like the lack of options. So in this case, it's Rosalina. I met her in the Bronx. She says, you know, my house is cold because I don't want to put the thermostat on high. And if I put it high, I can't afford it too much. But if she puts it too low, actually her family won't come and visit. So there's a real concern around social isolation and then the inhospitable kind of environment that can flow from this physical energy insecurity. And this is just a documentation of the different ways in which people talked about coping. And I just want to highlight that when households are experiencing both physical and economic expressions or dimensions of energy insecurity, 70% of them, 69% of them are keeping their homes too hot and too cold respectively. 67% of them are reducing expenses for basic necessities to pay their bills. Sometimes they're moving, sometimes they're using an oven for heat, 1 in 2 of them, leaving their homes or moving. So really these are consequential coping strategies that really impact the stability of how people are, where they live and how they live as a result. But when you look at where they're seeking assistance, actually 1 in 3 are actually seeking assistance, like financial assistance through government when they're experiencing these forms of energy insecurity. Now, when you have this kind of extended, long-term, unmet need around energy, very often households are meeting this kind of threshold of crisis. And that is, it really takes the form of a disconnection due to non-payment. And I just want to kind of say that disconnections due to non-payment affect 3% of the population, but they're actually inhumane almost 100% of the time. And the reason why I've come to that conclusion is that when I visited Marissa, who I met in Fresno, California, who was actively living through a disconnection. She was pregnant, she had 2 young children at the time as well. And she basically said, if you open that refrigerator, you will be shocked by the smell, so don't do that. She had tried to reach a number of different organizations, basically landed on a homelessness prevention outreach program that did a home visit, and that's how I was able to accompany this, this individual, Pedro. And she described that experience as savaging it, that for the 8 days that she had been without utility services up until that point, she was using the home basically as sleeping quarters only. She could not take, she or her children, they couldn't take a warm bath or shower. They couldn't cook. Their food had already spoiled. And they were relying on others to help them get through this. And the reality is that she was working and she was trying to pay as much as she could on her utilities, but eventually she just realized, I can't. There's no way that even when I get my next paycheck, I'm going to be able to catch up. And disconnections are one form of a loss of energy, but power outages are actually one of the more climate-related ways in which people are experiencing energy insecurity. And in Puerto Rico in 2017, Hurricanes Maria and Irma basically knocked out power in Puerto Rico for 83 days, the longest period for a population, a population-wide outage in U.S. history. While people might not recognize Puerto Rico as being part of the U.S., in fact, it is a territory. And the challenge of being without power for such an extended period of time was completely disruptive. It agitated all kinds of, it impacted a way of life for many people just to be able to manage the basics, from getting food to getting cash and gas and other things. And by the end of it, Manuel was just basically in a fog. He had just been coming up from being depressed for months on end, because while I guess the adrenaline rush of that initial need to respond to what was happening due to the loss of power, at some point he just kind of had succumbed to the circumstances. And you might be wondering by now, like, what could we do about this? I want to say that there are federal programs, the Low-Income Home Energy Assistance Program, the Weatherization Assistance Program. They have a legacy of having been basically, they originated in the 1970s due to the oil crisis, so they originated in crisis and haven't really been revisited or modernized since. And there's a huge enrollment eligibility gap. And right now, under the current administration, we don't necessarily know whether these programs will indeed survive. They did survive the first round of cuts, but who knows? So there's definitely lots of opportunities for thinking about enhancing the safety net. And there are actually some solutions that are implementable, and I really believe that there is a pathway to solutions. And some of it is actually acknowledging that we now live in a context where extreme heat is a problem, and that cooling assistance actually needs to be bolstered, and that would be one of many ways or several ways in which we could improve the current and enhance the current energy assistance safety net. But we need to be more comprehensive than that. In the last slide, I showed these images of umbrellas, and I think that that's important because I think it's really important for coverage to happen from above, not necessarily for our safety net to be designed to help people soften their fall. And so this Sparked Action framework is really about data. It's about participation in energy decision-making, about really figuring out different pathways toward affordability that isn't necessarily just about bill assistance, but also enhancing the energy and social safety nets that are available to us, increasing energy literacy, and doing more around efficiency and electrification and clean energy access, as well as disconnection reform. And I just want to return to Alicia's story because I really feel strongly about this idea of standing on solid ground and in your own power. And when I think about what it means to actually relieve a family like Alicia's of their concerns around energy insecurity, it actually means that they can meet their needs on an everyday basis, that they have what it takes to have the pride and the essentially the courage to walk in their own power. I think about, I grew up underprivileged, and there were times in which I was embarrassed about what I was wearing. And that's such a small thing, and yet it is so critical to how we think about how you walk in the world. So when I think about the relief that comes from this, it's really about disabusing people of those small insults that come along with poverty and material hardship, and in this very specific way around energy. And so my Radcliffe project will be dedicated to translating knowledge for local action and really to generate more people power around this issue. I have a number of active projects that are across states, mostly around working with New York State and enhancing the data that's necessary. Cities, what can cities do? Like, what are the local approaches? What can utilities do? They are such an important part of this work and often are underutilized as partners. And in clinical settings, what more can be done? And when I think about the images of relief, it's about comfort, health, dignity, connection, community well-being, and security that redefines resilience. And while some people might be really negative in this moment and trying to take a realist perspective to how we deal with the climate problem, I want to be encouraged by the fact that these are actually addressable issues. And with that, I want to say thank you for your time and attention.
Thank you.
Well, first off, just to launch us off on a conversation, I want to express my gratitude to Radcliffe and Salata for enabling this discussion and for bringing us here together. Diana and I were ecstatic to be able to come together at the same time, figure out how we're going to work together and make good trouble, as people like to say. I'm very honored to be in conversation about this incredible book that you've written on a very challenging topic. So I want to start out with kind of your approach to how you wrote about this issue, because I think this is one of the shining aspects of this book, is you and your co-author's capacity to have this kind of seamless integration of storytelling with data analysis. And those of us in public health really admire that because, quite frankly, we have very formulaic writing. We talk a lot about numbers, and facts and numbers can be boring to a general public. So can you say a little bit more about what inspired you to take this approach in the book and how you think storytelling can make energy insecurity real for public audiences, and the extent to which, how much did you have to work to get people to talk about what they were going through? Because in the end, you did talk about sort of issues of shame that people experience when they're going through these things.
Yeah, Rachel, I just have to say it's really such an honor to be sharing the stage with you. And in public health, indeed, we don't leverage the power of storytelling, in part because the ways that we think about data and privilege certain data is to say that, it's basically statistics, and there are some kind of regressions and correlations and these kinds of things that we, write papers and they're kind of relatively short and kind of get to a point. And even when it's qualitative, oftentimes it's thematically based, and it's just, a bunch of quotes that kind of illustrate a particular theme. But I thought it was actually important to see people in more of their entirety. So the woman in Detroit that, basically had this legacy in her home. The woman, Alicia's story, really kind of situating it in the pain of having lost her mom and the disappointment of having challenges in co-parenting because her long-term partner was dealing with a deep mental health issue. And, on the one hand, we could reduce people's experiences to these essential elements, but people are living their whole lives. And I thought it was important to write a book that really kind of got to that part, so that we could see how this is situated in the complexities of poverty, of disadvantage, of structural racism, and kind of be more whole there, but also the goal in my mind, because this is an issue that I know is important, but I have found it to be challenging to convince others that it is important and that it's worth further study, and that it's worth kind of continuing to find pathways to solutions, is also to connecting the heart, right? That's the storytelling part. The head, which is like, okay, you might think this is just one person, but actually we're going to show you that this is actually pretty ubiquitous and pretty prevalent in the population, and the hands, because it really is about also taking action, like what else can be done as a result of having learned about these experiences.
Yeah. So you describe in your book and also in your public writing energy insecurity as America's hidden hardship. In your op-ed, you wrote that energy insecurity is a, quote, predictable harm and preventable wrong when you wrote about that devastating Bronx fire that killed 17 people. And yet in your book, you also show that about 27% of Americans experience some form of energy insecurity. You state that 3 to 5% of households experience energy problems that affect their health, whether we're talking about respiratory health, mental health, sleep, other issues. So it kind of begs the question when I was reading it, why is it that energy insecurity is less well known in public and policy arenas as a critical economic, social, and public health threat? How do you explain this disconnect, especially in light of other forms of economic challenges that households face that we tend to know more about, whether we're talking about food insecurity or medical bankruptcy or credit card debt, for example?
Yeah, I mean, I feel like that's a question that I grapple with all the time. Like, why don't people see this? It's just so evident that it's happening. And I think part of it is that it's hidden behind closed doors, right? There are ways in which, let's say, street homelessness, right? When we encounter people that are unhoused, there's a way in which we might be able to appreciate housing insecurity related issues. That hunger is actually something that we all experience but could relate to if people might be having challenges in meeting their food needs or their nutritional needs. And so there's a way in which that relatability piece kind of makes it possible for people to be more empathetic around food insecurity. I think with energy issues, there are two things going on. One is this notion of poor but not public, that a lot of what is happening is also about kind of managing the circumstances more preventively. So under consuming energy as a way of keeping the prospects of a high bill, kind of managing that. And that we kind of commend people in many ways for being self-sacrificial, right? It's like, oh, you're strong for doing that. Not necessarily recognizing that indeed, actually, it can have health consequences and even consequences for life and survival. And I think that decision makers oftentimes, this is one of those, like, now I think our utility bills are getting more noticeable. But for a long time, actually, they were cheap enough that most people could ignore it, and it wasn't really an issue. I think that the times in which we were living with cheap energy in the US are behind us. And so now more people are paying attention, but it wasn't until it became more of a kind of universal issue that people have been paying a little bit more attention to it. And it really kind of comes down to costs in some ways.
Yeah, thanks for that. And which segues to my next question, and you alluded to this in the beginning of your talk. We're starting to face mounting extreme weather events from climate change. And I wanted to ask you to talk a bit more about the implications of that for American household energy insecurity. So I live in California. We're an epicenter of devastating wildfires. Power shutoffs are a regularity now, not an anomaly. And not just power shutoffs because the fires themselves, but there's more and more anticipatory power safety shutoffs by utilities, for example. So could you say a little bit more about the implications of this for energy insecurity? Are we entering an era where shutoffs are going to be more ubiquitous and not just, a quote-unquote poor person's problem? And what are the equity implications when we're trying to think about community climate resilience strategies?
Yeah. I want to talk about the kind of like slow crisis of extreme heat and the fact that extreme heat and cooling assistance, for instance, is really like such a small portion of the energy assistance or the energy safety net. And so I think the reality of climate change and rising temperatures basically will mean that we have to pay more attention to who has access to air conditioning and what kind of bill assistance is available so that people can actually use their air conditioning units when they need it most. And then there's another piece around what we're talking about. I talk about it in terms of outages. I think you're talking about like public safety shutoffs.
Yeah. Like what utility companies often do when they anticipate a fire.
Preemptively, yeah. Right. So outages, either because of storms, so extreme weather events, or because of the wildfire risk, for example, that often has to do with power lines, and how utility companies are much more on the hook, actually, than they were before. And so that liability piece is now taking them, putting them in positions to take these kind of more proactive measures around these blackouts or rather brownouts, so these kind of protective power outages. And when I think about the equity implications of that, I think about who has backup power. So the clean energy transition, while it may have been kind of diverted in the current administration, it no longer is kind of aligned with their priorities. It still was happening in California actually long before it was a federal priority. And what we have are actually some households, many of them privileged, that not only are kind of off-grid and so benefiting financially from that, but also have then the backup power systems that allow them to have a resilient source of energy in the context of something like this. And actually in Puerto Rico, we were just there over the summer, and I saw this, like, that was the big market. The big market was solar panels and battery storage as a way of kind of dealing with what is an unreliable energy system on the island. And so I think about the medically vulnerable and how without resilient, kind of a resilient power source or backup power, if they're relying on an electronic medical device, they're actually going to have problems breathing or sleeping without their sleep apnea machine or living at all. And so there are real concerns, but I'm also encouraged by the idea that some states were already on the path and they'll continue to do that work in the absence of a robust kind of federal agenda around this. But I think it's all the more important for sure.
Great, thank you. So now we're going to switch to questions from the audience. Again, I want to remind you that whether you're here in person or online, please submit your questions using the Slido. We're going to get through as many of them as we can. They're actually starting to roll in. One question is, you framed energy insecurity as structural, and how might policy design and public health intersect to restore agency to those most impacted by energy precarity? And I guess I would add, to what extent does your Spark framework sort of address that?
Yeah, that's a good question. I want to actually put it on its head, because what I've noticed actually is that there is so much agency, right? The coping part of that 3 dimensions is all about all the things that people are doing. But when Betty is saying, I'm doing all of this stuff, I really am, she could teach a whole class on energy conservation. But at this point, this is beyond what she is able to do, because this is more upstream. So one of the reasons why now we've been focusing a lot more on rates and rate design is because we have to go upstream from what individual action can do. So how much more can people sacrifice? There's a point at which this is about the housing structures that people are living in, again, modifiable. But if you take it even further than that, it's about, well, where is the profit? I think we really have to question. That's why I put that slide up, this, record-breaking revenue. And who is benefiting from that in a system that should be designed as a public service? These are public-private partnerships indeed. And we need to be holding this process and the utility companies to greater account around their public responsibilities and obligations.
Yeah. Back to kind of your approach to how you did the book project with your co-author. Can you say a little bit about some of the challenges you faced in terms of getting the data that you needed? And what are improvements that could be made at the city or state level to address this issue? And I think that's also kind of part of it's the S in your Spark framework as well. So yeah, Can you talk a little bit about those challenges and how to address them going forward?
Yeah, well, the Residential Energy Consumption Survey is basically administered every 4 to 5 years. Even after it's administered, there's a lag between them actually making it publicly available. So by the time you're able to report on the data, it's old. And it's really costly to run your own surveys. And so we actually need a better stream of data. We've been working with the New York City Department of Health and Mental Hygiene. They do regular community health surveys, and we've integrated some energy questions there. We're working with the electronic health record now, and that kind of 4th pillar around clinical screening. And what we find is that there's this wheel of social care needs, and there are questions around utility disconnection risk, but they're really underreported. So that is a potential source and really important, because there's a referral mechanism that can happen from physicians and other kind of clinicians. But if they don't know about it, they're not asking about it, I think it makes it impossible. And so there has to be, the USDA is reporting on food insecurity on an annual basis. We should actually be tracking this issue on an annual basis as well at the national level. And I think if we incorporate even a simple question, maybe it's a question around disconnection risk potentially, that can really help us to understand how prevalent this is. I would rather that there be more questions, but it's anything that gets monitored and measured, there's a potential for it to be improved. But to the extent that that's not happening, then it's really hard to actually even track progress toward household energy security.
Yeah, yeah. So this is a really interesting question, and I would say probably this new frontier that we're facing, which is the proliferation of data centers. And what are your thoughts about how its implications for energy and security, local utility bills? I mean, this is a huge emerging environmental justice issue right now. For example, what's going on in Memphis, Tennessee, and those kinds of things. So do you have any thoughts on that issue, emerging issue that we're all kind of frantically trying to figure out?
Well, I think the frantic part is part of the problem. So I think a lot of what's happening right now is that there's an urgency to get these data centers online. And so what's actually happening is that a lot of the negotiations around how to do that and like what the electricity rates will be and how they're socialized is really happening outside of the traditional kind of regulatory systems that are also more publicly, more transparent. From, there's a rate case on something, and usually it takes time, and there are multiple parties that are involved in that process, and that is actually not happening because there's this urgency to move fast on the data center. So there's really a lost opportunity for that, and I think the circumventing the regulatory process is a big challenge. But I think the other part of it is like the fact that all of us, the everyday citizens, are basically subsidizing corporate interests and profit-oriented entities. And that, I think, is we have to really challenge that notion. It's already the case that residential rates are more expensive than industrial and commercial rates, right? And now this becomes another example where everyday citizens are now then subsidizing business interests, and I think that it's a fight, and I think there's an imperative, and there should be an imperative to slow things down, because justice actually is temporal, and I think we can unpack that notion. But the temporality of justice is critical, because when you make fast decisions, oftentimes it's actually the people that stand to benefit least and be most disadvantaged by that fast action are the communities that actually need more time to process and to be considered in any of these decision-making processes.
Thanks. So this is another question that with electricity prices rising, which you showed us, with demand, cuts in renewables, and the slowdown of that in terms of energy development, how do we advance efforts to electrify households without adding to energy insecurity? There's a lot of concern about electrification programs, particularly for low and moderately income households, could potentially end up increasing their utility bills, or landlords may try to pass on the costs of electrification in terms of higher rents, which could then potentially lead to displacement. Yeah, so what are your thoughts on those challenges in terms of electrification going forward?
There are...
And this is our last question.
Yeah, and that's a hard question, actually. But I will say that there are different ways of also measuring the impacts of decarbonizing housing, as an example, right? And, moving away from fossil fuel-based heating and cooking and other things can have actually positive implications for indoor air quality and therefore for health. So that might be a way of kind of thinking about that calculus around the cost and benefits. Now, I will say that one of the things that we kind of offer up in the book and in the Sparked Action Framework is to rethink how we are utilizing the excess energy that is generated by let's say, rooftop solar and clean energy, and net metering and things like that. And like, is there a possibility for creating energy pantries, places where people can actually like get the kilowatts that they need for consumption? And are there possibilities, right? So like, if we're thinking about this more holistically, there might actually be other pathways that are opened up as a result of investing in the clean energy transition and continuing on that path.
Great. Well, thank you so much, Diana, for this incredible conversation. I want to also thank Radcliffe and the Salata Institute for Climate and Sustainability as part of Harvard's Climate Action Week. If you're interested in learning more about Climate Action Week, please visit the salatainstitute.harvard.edu website. And today's program has been recorded and will be posted at the Radcliffe website within about a week. And you can go check that out at radcliffe.harvard.edu. So thank you, everyone, for being with us here today.